The way your natural teeth come together is causing your jaw joints to get a little bit pushed back, and it's causing a lot of symptoms that you're having.
When we look at a patient, we look at the patient entirely. We don't just look at the teeth. We look at all the teeth. We look at how the teeth on this side affect the teeth on this side. We look at how the teeth affect the airway. We look at the health of the breathing. We look at the health of the joints. We do 6 different health assessments in a new patient visit. We look at the nasal function. We want to make sure there's no limitation of breathing space. We look at the bone level and the position of the joints. Oftentimes, we will see limitation of breathing for nasal, and we also will see limitation of space in the condyle. So this is the jaw joint. If we don't have an easy space for that joint to be able to move, and that means freedom of range, you have a little bit more space on the right side, very little on the left. So that's not giving patient a harmonious ability to have a natural range of motion when they open and close their mouth. So it also indicates that there's a lot of compression that could be potentially an issue for the patient. So long term, that can give patients uncomfortable jaw pain issues. We see a lot of patients with issues such as tinnitus and jaw joint clicking of their joints, and those are all because the jaw is limited in function and position of the teeth. Over time, we've realized that we need to address the function of the tongue. The tongue needs to seal the entire palate. So this is actually a patient that we treated with physiologic orthodontics, and after recognizing the function of the tongue, we addressed the tongue posture with myofunctional therapy.
What that's doing is it's bringing your lower jaw forward. So it's allowing your mandible, your lower jaw, to come more forward just by the way these teeth are designed. So every time you open and close, it allows you to close in a different position that's more comfortable for your jaw joints. So that's the goal of this treatment.
Dr. Mike is actually one of less than 2% in the entire world that has the kind of training he has. We also utilize a CBCT, which is a 3-dimensional X-ray. We utilize it for bite. We utilize it for TMJ patients. We use it for sleep patients. We look at airway. We actually are able to find things that are not visible on any other typical radiographs.
So this is my new bite.
So I'm sure you notice it's a lot more forward, right?
Yeah.
You have to bring your jaw, you literally have to bring your jaw forward to.
Yeah.
Okay.
I
So,
like that.
well, good. I like that attitude.
No patient will have a similar circumstance, and so when we have an opportunity to be able to restore healthy function for a patient and they welcome the opportunity to receive that, it's just such a fulfilling opportunity for us because we know we can make a difference, and when the patient is able to have that difference made, it's just a win-win for everyone.